Here we have our sheep heart dissection. The top is the base, which is the attachment point for all the blood vessels. The bottom, near the ventricles, is the apex. The heart is composed of 4 chambers. On the top we have the atria, on the bottom we have the ventricles. At the top we have multiple different blood vessels. Here we have the aorta, which pumps blood from the left ventricle into the rest of the body. On the brachiocephalic trunk, it splits into the subclavian artery and the right common carotid artery. Superiorly, we have the superior vena cava. Below that would be the inferior vena cava. The vena cava are veins that bring blood back from circulation into the right atrium, then the right ventricle, then through the pulmonary trunk and pulmonary arteries to the lungs for oxygenation. Semi-ulnar valves are the valves between the aorta and the left ventricle and the pulmonary artery and the right ventricle. Arteries lead blood away from the heart, and veins bring blood to the heart. The trabeculae carnae are ridges and folds that are on the walls of the ventricles. The papillary muscles connect to the chordae tendineae, which connect to the valves. Here we can see the chordae tendineae. They attach to the AV valves, to the papillary muscles. The AV valves are the bicuspid and the tricuspid. Here from the left ventricle, we have the bicuspid. On the other side, we have the tricuspid. From the right atria, blood flows into the right ventricle, which then comes up into the pulmonary artery. The pulmonary artery sends the deoxygenated blood to the lungs, which then comes back through the pulmonary veins into the left atrium, and which then comes into the left ventricle, which comes out through the aorta here and into the rest of the body. With the posterior side removed, we can get a better view of the right and left atrium. Here's the left atrium that connects to the left ventricle through the bicuspid valve seen there. And here we can get a look at the auricle, which creates more room for the atrium to hold blood. Here we have the right atrium, which receives blood from the body. And here we have the tricuspid valve that leads into the right ventricles. Superior to that would be the superior vena cava, and the inferior vena cava would come up from the bottom. Here we have the intraventricular septum, and here we can get a good look at the difference in wall thickness between the right ventricle and the left ventricle, due to the left ventricle needing more force to pump blood into the system. The auricle is an ear-like flap that's attached to the atrium. And the coronary artery is an artery that leads from the aorta and brings oxygenated blood to the heart muscle.